one
Yes,
delivery.
yes.
So wash hands and then gloves.
So you really have to wash your hands, no? Okay. Please, see me wash, no? How are you supposed to wash?
Happy birthday.
Actually, that happy birthday is no longer counted. It's more of the number of seconds when you do the washing, no, that you finish you singing the happy birthday. But you have to really be strict on the step by step. Okay, so first is you have to lather your hands with wet with water and then soap. Tapos palm to palm. Okay. After that, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Wrist. Okay? So, all the steps really has kind of clean every part of your hands. No? So, Anna, you're cleaning the palms. Here, the dorsum of the hand. Here, interdigital. Then this one, we're cleaning here, here, yes, the knuckles included, and tips. Okay, that's why when you do like that, it's sometimes optional. Okay, you did it like that now. But don't forget, this one has not been cleaned yet, so it has to be cleaned separately. No, Anna. So for every procedure, it is 5. So total of about 20 to 30 seconds. No? So after that, you wash with water. So clean hands na ka. You have to make sure that when you have you have washed your hands, you have to dry it. No? So pwede paper towel, no? Paper towel or clean cloth section. So for example, position sa inyong hand. Because supposedly you will be using a stereo gloves, no? So stereo glove siya. So, when you open a stereo pack, nakaingon-ani mo siya, no? So, ano portion? So you have to lift it up, no? And so don't touch anything that is there on the surface outside. So you put another one again and so you put this one and insert. Okay? There are times, balik na ko ha, there are times when you are inserting your gloves, dili din siya maswak sa hands. So there's a tendency, no? And the common tendency po sa first timer is matempt sila. So, igsud nila. So, no touch. So, anak nila, perfect na kaayo. Pagsud nila, na anak. So, ayaw mo katempt ang anak. Just wait, no? Insert the other one and do like that. Once it's all inserted, glove na, that's the time. And then, okay.
What if the both nag-error? Both hands nag-error?
Okay lang. Suit it as it is. No? So, halimbawa, first time mo. Pero I'll show you later din how to glove a one person. Mas fun din siya. So, halimbawa, nisud ka. Pag sud mo, anak mo na, or na crumpled na siya, or butang ka lang. Na anak. So, sud ka sa usa. And then the other one is like that. Pag sud mo, na anak na sad siya. O di wala tayo problema. Arrange. No? No, pagsa. Ibig kayo mo tawag, pabangon na hinuon ka.
Okay, manawag ka
Sige.
assistant to.
So, okay. Make sure, number 1, Sige, let's start. Number 1.
Call out time of birth
Dito
and
pang
gender.
prepare
Ay,
equipment, no?
prepare equipment, gloves, instruments, cord clamp, blankets, bonnet.
Bonnet. Wala. Dapat na mo bonnet, ha?
And wash hands and don gloves. Then after that, kay call out time of birth and gender.
Okay. So, kaning number 1, that's really very important. 25 to 28 degrees, you have to mention that. No? Si Katipay, dako man din mo siya. Abi na may gamay na siya. Sige. So, you have to prepare before you wash your hands. After washing, you glove, no? And then you, the delivery. Okay? Delivery, baby boy. Baby boy did siya. 10:15 a.m. baby boy. So, you put the baby there. And then, wipe na tayo.
Well, nag-cry siya, Doc.
Yes. Kala na siya din ha, no? And then after that, you remove this one.
Remove the wet linen.
Sweat.
Then, you prone, covered. Place the
Dapat
baby
bonnet
prone,
lang siya.
yes, Doc.
Mm-mm.
Prone into the mother's abdomen or chest. And cover with warm, dry blanket and bone net.
Okay, continue.
Then inject oxytocin, 1 EU, 1 IU,
10.
ay 10 din.
International units.
10 U,
10 IU.
10 IU,
International units.
intramuscular on mother's arm after excluding a second baby.
Okay. So, you have to make sure that there's no other baby already. How would you make sure? Siyempre, anak niyo sa uterus, wala na iswag, no? So, anak. And then, when you inject, it should be, can I have the phone?
Yes.
Okay. So, let's say this is the deltoid of the patient, no? So, you are preparing a 1 cc oxytocin. So, once you inject, as much as possible, anak lang sa atin, push. Aspirate pala, not intravascular. And then, press na dayon with cotton and plaster. Okay? Ideally, in hospital setting, you shouldn't be recapping because that's the risk for needle stick injury. So sometimes you do fishing, no? So ang ba mo, imuhang tray. So you just have to do it like that. No? And then set it aside. Okay? So, or you have to do it like that. Basta as much as possible, do not recap. Okay, matusok yung tikas na mo, especially when you are in a hurry. Then,
Then clamp and cut cord between 1 to 3 minutes
Okay.
or when pulsation stops.
so while you are doing all those things during the injection, you have to feel for the pulsation. If wala na, then you have to cut it, to clamp it. No, so if this is the kanang baby, ganit here sa ha, wala. You have to clamp it here at least 2 cm.
2 cm with sterile cord clamp.
Kailan na to i-clamp maayon kaya ito madarot siya.
um,
So, anak.
and 5 cm from the base.
Okay, sorry. This should be the first one. Anak, and then 5 cm. Okay? So, you are supposed to cut
Cut close to the cord clamp.
no? Or anything, anywhere between. Ay, lang sab kayo ninyo i-untok. Oo, okay. What if naa siya portion nga wa na clamp properly because of malfunction of the clamp, so mulik siya, that is naa pa kay chance na ma-clamp nimo. So at least 2 cm and then 5 cm from the base ang clamp and then cut it in between. Okay? Okay. So now, release na si baby. You have to tell the mom, no, to hug the baby. The warmth of the abdomen will warm the baby also. That's the purpose, no? So, anak. So, we usually do three procedures to prevent active stage of labor, bleeding, or prevent postpartum hemorrhage. So, one is when you give the oxytocin on the deltoid. And then after that, that will stimulate contraction. So the stimulation of contraction will actually, the contraction of the uterus stimulates the placental separation. So once it's separated, no, let's say, I just have to do it like this, kay very, lisod ni siya, ipagawas. Okay, so, you're done, no? Clamp na ni siya. So, you just have to, kapanta lang na other imong kuan. So, you have to do it. So, murag mo siyang ituyok. Okay? Until you're there. So, it's inside pa man, di ba? You don't know what whether. So, maybe when you palpate, di pa ganyan mo hikapan ang placenta. The placenta is most likely above the cervix pa. So, you have to do controlled contraction. That's the next thing that you have to do to facilitate placental separation. So, how do you do that? You have to pull gently, at the same time push the symphysis pubis to prevent uterine inversion. No? So when you do it like that, okay, do it, and then of course there are signs of placental separation. So once it's already separated, it's out. The purpose of doing a controlled traction is because if you're just there staying and waiting, it can take hours before the placenta is delivered. The longer the third stage of labor, the higher is the risk for bleeding. No? So that's why you have to also facilitate the delivery of the placenta. So at least within 30 minutes, that's the best. No? And then once it's delivered, you have to check. So there are cotyledones, no? So it's really very obvious when you're doing it, when you're observing the placenta on an actual patient, no? Coming out from an actual patient. Eh, kalimbawa kami siya napahak, mabilin inside, this would continuously bleed. More so the one that's attached in the uterus. So that's the one causing retained placental fragments, no? Or kaya syempre, if this will not be removed, that's undelivered placenta. If there's a portion na remove siya, but there's a portion lacking, patient is continuously bleeding, then that's retained secundins, meaning a portion of the placenta is left inside. And that's why you probably need to do manual exploration, no? So you have to do it like that, or if not, you retouch. Okay? It's not routine anymore to do manual exploration, no? So you cannot just insert your hands and do the manual exploration on all patients. So it has to be indicated. Okay? And then of course this has to be placed in a placental basin, no? Kay it para you can still have to check whether it's completely delivered. Okay? So mananata, what's next?
Then examine birth canal for bleeding and laceration.
Okay.
And repair episiotomy if done. And remove gloves, discard properly, wash hands, keep baby skin to skin contact with the mother.
Napawailing gloves. Okay.
Doc, what if ay di ba some doc kay dili man na i-cut ang may some pictures na ang baby kay attached kaya sa placenta. Diba naman na yan?
No, it should be delivered.
Kaya I saw meron siya pictorial siya sa baby. Attached kaya po ng baby sa placenta.
Aba sila pictorial ang sila for that matter. Pero hindi siya pwede there.
Hindi siya pwede.
Sige, sagdi lang na nato mga, there are some good nga they go for alternative way of delivery or traditional, very traditional na.
Some doc they eat the placenta.
Nay Muslim na to, Derek. Di ba sa Muslim, sometimes you get the placenta to lubong. Unsa bang kamara now?
Magpaganda na ako.
Okay. I'm not sure unsa din specific kasi there are patients na mga Muslim na they'll really get the placenta.
Ay, oo, Dok. Kay prayer man ko, Dok.
Oh, kay part daw na siya sa so they need to bury it within the house or something like that. But for infection control purposes, we're not